Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Abayomi Ajayi, founder, medical director and chief executive officer of Nordical Fertility Center, and he is going to share his expertise on PCOS, also known as Polycystic Ovarian Syndrome. Good evening, Dr. Ajayi, and thanks for joining us today.
Yes, thank you so much. Good evening, Sumbo. How are you?
I'm fine, sir. So let's get the ball rolling. What is PCOS, called Polycystic Ovarian Syndrome? And just let us know what this condition is.
This is a very common, just like your intro, but frequently misdiagnosed or undiagnosed hormonal condition. It's said to be the commonest hormonal condition in women in their reproductive age group. And usually it causes people from having frequent ovulation or irregular menstruation, and therefore sometimes affects their fertility. But I must say from the get-go, there is not only fertility that it affects, it can also affect the metabolic function of the body, like the ability to develop diabetes in later life, and also has, because of some of the characteristics we're going to describe along this program, has some psychological impact on women who have it. It might even lead to depression in some.
Okay, so is this condition the same as endometriosis? Because we have series of conditions affecting women. Is this also similar to endometriosis?
Well, not exactly, not at all. They probably do, they're not related at all. But on ultrasound, this might be confusing sometimes, but they are not related at all. This is a completely hormonal, if you like, imbalance, as people say in Nigeria, you know. So it's different from endometriosis completely.
All right. Can we tell what causes this condition in women, and is it also age specific? Does it affect a particular reproductive age?
Yeah, it affects women in their reproductive age. We don't know exactly what causes it, but there's some things that we have seen that might cause it. Then we'll go to the symptoms. Okay. We think the insulin resistance is one of the things that we think might cause polycystic ovarian syndrome. And this is what I mean. Insulin is a hormone that is produced by the pancreas, which is responsible for us to be able to use sugar, to drive sugar into our muscles and cells, and for us to be able to use it. So, and what helps us to break down this is this, what we call insulin, or makes the sugar to go into our cells. Now, sometimes some people have this resistance to this insulin, so they have to produce more insulin in order for the insulin to be sufficient, as it were. And they do this until probably the pancreas now gets wearied out. And then, so that's why sometimes they can develop diabetes. But before that happens, what happens is that these women now tend to produce a lot of male hormones. And that is what is responsible for some of the symptoms that we see. Okay. Then also we think there's some low-grade inflammation going on in this woman. And these are things that might be responsible for their ability to develop hypertension and cardiovascular diseases in later life. So if we look at the symptoms of polycystic ovarian syndrome, we will see that the commonest thing will be that these women don't tend to menstruate regularly. Okay, and when we say somebody is not menstruating regularly, we mean that the menses is less than 21 days, and the period between one menses and another is less than 21 days or greater than 35 days. And this usually, because they don't menstruate regularly, when they menstruate, sometimes it's very heavy. Okay, because they built up the endometrium, as it were, and when they shed it, it's really very heavy. Also, we say that a woman is not menstruating regularly if she does not menstruate up to 8 times in a year. We tend to not menstruate up to about 8 times in a year, and so that's what we call irregular menses. The second thing they have is that because they have These male hormones that is higher than in other women, they tend to have what we call hirsutism, which is the like male hair distribution. So they have abnormal hair distribution either in their face, so they tend to have facial hair or beards, or mustache, or sideburns, and also sometimes they have hairs in their chest, and so on and so forth. And then so that is just showing that they have more male hormones than normal. And then the third thing is that when you do a scan, these women tend to have, that's why it's called polycystic ovarian syndrome. They tend to have multiple cysts on their ovaries. These cysts are usually very small, between 2 to 9 mm in diameter. And they are just eggs that have been arrested at various phases of development. So we usually say that for you to make a diagnosis of polycystic ovarian syndrome, you need to have 2 out of these 3 things.
Okay.
So it's not proper for us just to see polycystic ovaries on scan and then label such a patient or a woman as having PCOS. Because PCOS is not a diagnosis that you just have and throw away, because like I said, it could have other bearing in future. There might be other implications for it. So the diagnosis needs to be made carefully. But even the people who have had diagnosis made, and that's why I like your intro, sometimes they report that the doctors are not treating them appropriately, in the sense that we know that it's not only fertility that this thing affects, that PCOS affects. It also can affect your cardiovascular system and can affect metabolic syndrome, your metabolic system, and also can have psychological impact on your well-being.
Okay. Can this condition be life-threatening? Because you said oftentimes women experiencing this condition also encounter misdiagnosis or wrong diagnosis. Can this be life-threatening? Because by the time they show up at the health facility, it is way too late.
Well, fortunately, it's not. One cannot say it's life-threatening. Yet, it could have implications for later life. Example, one can develop diabetes. Now, if the diabetes is not well controlled, yes, that is true. It predisposes women also to hypertension and heart disease. So, yes, what we probably can say is that you can probably truncate some of this sequelae before they happen. But I won't really tell you that it's really life-threatening.
All right. Are these hormones reversible? Women, you cited earlier on that women also come up with male hormones. Can these hormones be reversed?
Yeah, sure. That's the good thing about. That's why diagnosis is probably very important. Probably even early diagnosis, because these hormones can really be reversed or made to be in the proportion that they're supposed to be in. And so, yes, once the diagnosis is made, there are so many avenues. Probably number one is that lifestyle. You know, we've seen that because many of these women tend to be obese because of all these things that we've spoken about. So weight loss is one thing. And they said that if you lose about 5% of your weight, some of these hormones actually can sort of go back to the normal sequence that they were before. So yes, weight loss, so a little bit of exercise and especially the diet, what you eat is so important in this women. Yes, and then of course we have drugs that we can use to reverse this trend. For example, the pills is one of the things that is commonly used for those who are not seeking to have children yet. The pill tends to correct this disproportion.
All right, Dr. Ajayi, because we don't know the causes of PCOS, are there risk factors that predisposes someone to having PCOS?
Yes, heredity. We think there's some genes that are responsible for transmitting polycystic ovarian syndrome, though they are not identified yet. So that's why it's commoner in families. So yeah, it's definitely heredity is one of the things that we think might just be one of the risk factors for PCOS.
All right. Before we go to how to manage or how to live with PCOS, you said earlier in your response that it affects a particular reproductive age. Can women in the menopausal stage also experience PCOS? Because at times they say when a woman is experiencing menopause, she's free from major gender-related conditions.
Very true. But the only problem is that if you have developed diabetes, it probably won't go away because you have hit menopause. We'll probably still have to manage that. So, yeah, that's why we're saying that some of those sequelae we shouldn't get into it, because being a hormonal issue, by the time you hit menopause, majority of the things, for example, we don't no longer know that you're not ovulating anymore. But things like predisposition to uterine cancer those risks might still be there, and then if you have developed diabetes or have hypertension, those things might just still be there even after you have hit menopause.
Okay. Are there also ethnic variations apart from family ties that may come up with PCOS? Is it more common in a particular ethnic group?
Yeah, we think that that it might be commoner in the Mediterranean, but fortunately they also have the good diet that they eat. So yes, it seems as if it might be commoner with some races than others. Yes, but don't let us confuse simple hirsutism, which is just excessive hair growth, to polycystic ovarian syndrome. The two are not always the same. So we know that some races, some tribes tend to be more hairy than the others. We shouldn't confuse the two of them because they might not be polycystic ovarian syndrome.
All right, Dr. Ajayi, since the condition is untreatable, are there tips, tips you can share with viewers at home that can be helpful in living with PCOS?
I'm sure what you mean is the incurable.
Yes.
Because we can treat
incurable, yes. Incurable is the word.
We can treat it, but it's not curable because it's the way you are wired. Yes. Yes, I think the first thing that, like you said, is that we should always aim to have an early diagnosis so that all the things that we need to do can be done with early diagnosis. So yes, we can give you some tips, and we can look at some of these things. For example, a woman who is not menstruating regularly, that's probably the commonest symptom of PCOS. And then if this is now followed by other things like she's obese, other things like she has excessive hair growth, then these are things that we need to be sorted out early, before the complications actually arise. Yes, I think that's the way to go about that.
All right, fortunately for us, we are in the month of PCOS where we create awareness about polycystic ovarian syndrome. Let us have your call to action as we wrap up now.
Yes, well, I think one of the things that we need to continue to talk about the awareness, just like we said that a large chunk of these women are not diagnosed on time, and even those who are diagnosed also, a large chunk are saying that they are not looked at, holistically. Like William Osler made a quotation many years ago that good doctors treat diseases, great doctors treat the person who has the disease. So we all need to transcend from just being good doctors to great doctors to know what are the needs of these patients, and part of it will be the psychological well-being. I remember when I was in school, there used to be a particular lady that used to go to the supermarket to buy shaving powder, then, and then there's this hair remover, Vito, whatever, I've forgotten the name. And everybody knew she was stigmatized for being fighting with boys to get shaving cream.
Wow.
those are some of the things that these women go through, and people tend to neglect that. So I think it's important that we treat the patient as a whole and be able to take care of all their needs. So I think the awareness is very important for not only for the patients but also for medical practitioners to be able to pay attention to exactly what the needs of these patients are, and for us to look at them wholly.
All right, Dr. Abayomi, before I let you go, one area we did not touch at all is infertility. Are women prone to infertility when they are living with PCOS?
Oh yes, because we said that they don't regularly. If you don't ovulate, you're not likely to get pregnant. So infertility is a major problem that they have, and some of them, if there are no other things involved, for example, if it's just PCOS, that means they're just not ovulating. We can get away by making them to ovulate, but some will now, there will be a complication of either there's also a male factor, and therefore such people will probably end up having IVF. But PCOS on its own is not an indication for IVF. So because there are so many drugs that we can use to make them ovulate, it's either when we're not successful with using the drugs, or there's another factor like the male also added to it. That is when now we recommend IVF.
All right, doctor.
And they tend to do very well with IVF, and so yeah.
All right, Dr. Abayomi Ajayi, Medical Director, Chief Executive Officer, Nordical Fertility Center. Thank you so much for your time and expertise on polycystic ovarian syndrome. We really appreciate you.
My pleasure. Anytime, Alasu.
Abayomi Ajayi on how to live with polycystic ovarian syndrome known as PCOS. You need to report symptoms early enough to your healthcare provider. It saves you a lot of pain and stress.